And then there are people who experience what they call chemo brain, or post-chemo fatigue or post-radiation fatigue, or complications in terms of tissue healing, which are often a function of disturbed oxygenation to local tissue sites, which might be, again, improved by these therapies. And so in that group, for me at this point, it's always worth doing a measurement, seeing where they are, and at least offering them this strategy in as careful and in as controlled a way as possible. They did a lot of work in people with the spectrum of cardiovascular diseases. And we have had, I think we can clearly say in our little clinic, seen some rather dramatic benefits in people with pretty advanced cardiac disease, heart failure, who have had very substantial benefits in exercise capacity and reduction in symptom severity by participating in the program. I think Barbara can speak to that. And I think, when I can say something that isn't speculation but is observation, I will. And I do think that I feel very comfortable that in that subgroup of people, the regular participation with the oxygen step therapy is very effective in people with, say, congestive heart failure, or ischemic heart disease, or peripheral arterial insufficiency. And we think that it's been pretty effective in people who have what I characterize as mild cognitive impairment. That is to say, people who don't have official dementia or Alzheimer's disease, but they have various or subtle manifestations of an impairment in cognitive function. And in those people, based on our observations and on the observation of their family, there's been a nice improvement. And I think that improvement can be sustained as long as we can follow them closely and make sure that when we see a decline in oxygenation, that they redress it with access to the gym, or just use the gym on a regular basis. I think in people with very advanced disease, like Alzheimer's disease, I don't think we can hope for very much benefit. It hasn't seemed to be effective in that group. And there are a variety of other types of problems, whether it's chronic fatigue, fibromyalgia spectrum, the people who either have had Lyme and feel continuously ill after Lyme. This is just to me a really valuable way to try to reconstitute their health, other than continuously hammering them with antibiotics, which may or may not be what they need. So so I've been just trying to understand how best to place this, and Barbara and I are continuously trying to figure out, well, how will we follow people so we can document as carefully as possible what benefits we have in fact achieved. There are some ways of measuring mild cognitive impairment that aren't profoundly expensive, but do have, let's say, sanction of research groups as being scientifically valid, that are more significant or more sensitive than the mini-mental test. And we'll slowly try to build some protocols that will help us with those subgroups of people. So I'll take more questions now and see if you, yes?
I guess we have to reveal some things because it's obviously personal, but what is the mechanism for the efficacy of the oxygen process that you're talking about in terms of peripheral vascular disease? Just briefly, how does it work, and what is the evidence? And secondly, in the first part of your talk earlier, in terms of one's conditioning program, it seems that you presented some mechanisms that you have that can help make one's exercise programs and physical goals more effective.
Right.
So come back to those.
Okay,
If you
well,
could help me with that.
in terms of peripheral vascular disease, I think, we have a fairly, I want to back up and say, someone remind me to return to the issue of cognitive dysfunction and mild cognitive impairment and Alzheimer's, because there's an important relationship to vascular disease, which is kind of, I would say, emerging in the thinking of mainstream medicine. But in peripheral vascular disease, there's the macrocircular, the large blood vessels, which we mostly pay attention to. That is to say, the iliac artery and the femoral artery develop arteriosclerotic narrowing, and the experience then is of pain with exercise, claudication. So what it doesn't address is the microcirculation and the adequacy. We don't have a way to address the adequacy of the microcirculation, the capillary beds, and the ability to, if you would, move oxygen from the capillary beds into the tissue. And what we can actually do with this transcutaneous arterial partial pressure of oxygen measurement is measure how good the tissue is oxygenated. And again, when there is a perception by these cells of an inadequate amount of oxygen delivery and blood delivery, there's actually a swelling of the capillaries. The swelling of the capillaries increases the sludging and viscosity of the blood. And if you can reduce that, you do get an improvement in microcirculation and oxygen delivery to the tissue. And it's the pain in the tissue from lack of oxygen that you experience as the symptom of claudication. So, my idea would be, have an objective way of measuring what you want to change, and enter the therapeutic process, and see if indeed there is the desired outcome. In anyone with peripheral arterial disease, regular exercise to the limit of ischemia, of pain in the muscle, is valuable and improves their exercise capacity, but it doesn't necessarily reduce the progression of narrowing and inflammation of the blood vessels. And in part, some part of that process is due to physiologic forces such as chronic hypertension. Some part of that process is due to, let's say, biochemical aspects, let's say cholesterol loosely, although many people debate this. And some part of it is due to inflammatory effects. That is to say, an oxidized LDL cholesterol is more atherogenic than a non-oxidized. And if LDL cholesterol isn't oxidized, maybe we could tolerate higher levels. And so I would say that on the one hand there'd be dietary issues, on the other hand optimization of medication, but I do think the oxygen step therapy would improve exercise performance. And I do think we've also had some experience with that in the whole body vibration.
Yes, we've had a couple patients, and one was diabetic, one had peripheral vascular disease. He had a lot of neuropathy or pain in his lower leg and feet. And I'm very sure from standing next to him when he is here working in the gym that has cleared up. He has not had any further pain in his feet. Now he has to come back periodically.
Yeah.
He's got to tweak it.
Which has been a really nice little discovery that for peripheral neuropathy, we think we have a tool that might be useful.